Understanding fluid balance, a guide to hydration. Fluid balance is all about keeping the right amount of fluid in your body. This balance is crucial for your overall health and the functioning of your organs, including your bladder. When you stay properly hydrated, your body can produce enough urine. This helps flush out toxins and reduces the risk of urinary tract infections and bladder irritation. Your body manages fluid balance through what you take in and what you lose. You get fluids from drinking and eating, while you lose them through urine, sweat, breathing, and bowel movements. On average, healthy adults need about 1,600 milliliters of water each day from both drinks and food. This intake should match the amount of fluid you lose. The kidneys are key players in this process. They adjust how much water and electrolytes your body excretes to keep your blood volume and concentration stable. Staying well hydrated is especially important for bladder health. When you are dehydrated, your urine can become concentrated, which may irritate the bladder lining. This irritation can lead to urinary tract infections and discomfort. Dehydration can also cause problems like urinary retention, where the bladder does not empty completely. This can increase the risk of infections and complicate the management of bladder cancer. In clinical settings, healthcare providers closely monitor fluid balance, especially for patients with bladder health issues. This helps prevent dehydration and its complications. Dehydration can lead to serious risks, including urinary tract infections, confusion, constipation, and longer hospital stays. Monitoring fluid intake and output is essential. Healthcare providers assess physical signs like blood pressure and urine output to adjust fluid administration as needed. For patients who cannot drink enough fluids, intravenous fluids may be given. This therapy is personalized based on individual needs and any ongoing losses, such as from vomiting or diarrhea. The goal is to maintain a positive fluid balance without causing overload, which can harm bladder and kidney function. To support bladder health, here are some practical tips for maintaining fluid balance. Aim to drink around 2 liters of water daily, adjusting for your activity level, climate, and health status. It is wise to limit bladder irritants like caffeine and alcohol, as these can increase urine production and sensitivity. A simple way to check your hydration is by monitoring the color of your urine. Pale yellow usually means you are well hydrated, while dark urine can indicate dehydration. If you have bladder cancer or other bladder conditions, it is essential to follow your healthcare provider's advice on fluid intake, as treatment and symptoms can change your hydration needs. In conclusion, understanding fluid balance is vital for bladder health. Proper hydration helps prevent bladder infections and complications related to bladder cancer. It supports the urinary system's function and contributes to your overall well-being. Always consult with healthcare professionals for personalized advice on hydration and bladder health.